Let's talk about gluteal tendinopathy. That's that pain on the side of your hip that you experience probably halfway through your run, gets worse once you finish, potentially plagues you at night time when you're sleeping on that side, and then you feel it the next morning. So what is gluteal tendinopathy? It's an irritation of your gluteal tendon, which is the attachment point for part of your glute max, but more importantly, your glute med muscle, which is responsible for pelvic stability. So when you're on a single leg position whilst running, it's what keeps the pelvis nice and level and stops the pelvis from moving side to side. Why can the glute tendon get irritated? Well, it's very simple and similar to things like your Achilles tendon. So bringing in too much load too fast, too soon. Unfortunately, it tends to affect female runners a little bit more than it does male runners. Being female, you have wider hips, which creates a greater angle as the leg goes downwards, puts a bit more strain on the gluteal tendon. And then if you add in too much running load, if your glute's not strong and stable enough, that's going to start to cause some issues down the line. So what can you do to assess your gluteal tendon? Well, the first thing is palpation. With tendinopathies, we know that it's quite point specific and localized to a specific area. So palpating around your gluteal bone on the side of your hip, pressing and probing in there, should elicit some of your symptoms. You do need to press a little bit deeper because it is quite a large, muscular, fleshy area. So pressing a little bit deeper is going to help. Press both sides so you understand what pressure and pain feels like and what the difference is between pressure and pain. Another reason your gluteal tendon might get irritated is due to poor running technique. So if you're overstriding and you have a crossover gait pattern, that hip is going to go further into your midline, causing the tendon to get stretched and strained a bit further. And lastly, we're looking at your environmental factors. Where do you run? Is it trail? Is it quite hilly and undulating? Is it road? And is the road quite cambered or cobbled, which might force the leg to go inwards a bit more, which might change the angle and the rotation of your foot, which is directly correlated to the rotation of your hip. Another way to assess your gluteal tendon is to do a step down test. As you go down into a step down, it winds up the gluteal tendon in the lower position, and then you feel the strain and push as you drive back up into a nice level position. It's also going to give us some information as to the quality of movement. So as you're rolling down into your step down, does your hip poke out? Do you lack the stability to control the pelvis? And that's another telltale sign that your gluteal tendon and muscle isn't strong enough to tolerate the load that you're putting through it. So with all that being said, putting everything into perspective. What's your running training been like? Have you spiked load? Has there been a change in environment? Has there been a change in running technique potentially as well? And does that all line up to pointing signs to as your gluteal tendon being irritated? And most importantly, seek some professional help, whether it's a sports medicine consultant, a physiotherapist, or a health professional in your home country.